am pleased to be able to have this conversation with Professor Diana Kenny from Sydney, Australia, whose book Intransigence, Gender Ideology, Social Contagion, and the Scandal of Youth Gender Medicine has recently been published. Diana has been an early and vocal critic of youth gender medicine. Thank you, Diana.
There are other issues as well for women on testosterone, and one of them is very severe acne, which is really unpleasant and very difficult to treat. And another condition called polycythemia, which means that you develop too many red blood cells and become much more at more increased risk of clotting and stroke and cardiac conditions, because your cholesterol also goes up if you've got too much testosterone. And other issues are hypertension and type 2 diabetes can develop if you've been on testosterone for a long period. The list really just goes on. And one of the really difficult things is that these people develop male pattern baldness and they get facial and body hair, which is very difficult to get rid of if you decide to detransition. And unfortunately, there's an irreversible lowering of the voice pitch. So there are so many problems. I'm sure I've left some out, but deep vein thrombosis and embolisms, it's really quite terrifying when you look at all the list of, complications that can occur. And it's true that a lot of them are low frequency, but if there's so many things that can go wrong, you're bound to, experience one or more of those things, which can make your life extremely difficult.
Yeah, I developed sleep apnea before I started transitioning, but I understand that with young girls who start testosterone or puberty blockers before entering into puberty and then move on to testosterone within 2 years, that their voice box doesn't ever grow even to female normal size, yet alone male normal size. And yet they have the narrowing of the voice box in response to the testosterone. So their voice box narrows, their tongue thickens, and they've got these two things closing off their airways. And the common surgeries to fix that won't work because everything is too small. And that's not something I hear has been discussed with like a young 10-year-old girl that you may have difficulty breathing when you're 20.
Well, that is a revelation to me. I haven't heard that before. And it sounds dreadful. And it sounds like a very well-kept secret, in people who are peddling youth gender medicine. So thanks for alerting me to that. Um, I know that the voice change is irreversible. And if you want to detransition, you have to have a lot of speech therapy to try and artificially raise the pitch of your voice. And you have to be constantly vigilant about using the techniques, so that you don't give yourself away, so to speak, and drop into that deep male sounding voice. Um, so testosterone has also been associated with increases in irritability, low frustration tolerance, and increased anger and aggression are some of the psychological effects. And of course, there's greater risk of weight gain and obesity. So there are just a huge number of problems that accrue if you stay on it, for any length of time. Um, and people really need to know that, this is what happens. In the early days, the informed consent documents that the people were supposed to sign were sort of one page. And now, because so much has been discovered about the adverse effects of these drugs, the gender clinics have been forced to update their informed consent forms, and now some of them are running into 10 pages. But
Wow.
just because you put it down on paper, it doesn't mean that people understand it, especially young people. And so they might sign it, and the gender doctors think they're protected from liability because these things have been explained to people. But if they haven't got the cognitive wherewithal to understand it, it's not informed consent.
Well, and children have a hard time figuring out if they've been deceived. Like, I heard this story from more than one detransitioner, where the first time they heard about an increased risk of suicide was from the person who was promoting transitioning to them. With one individual, her and her mother were sitting in the doctor's office, and the doctor said to the mother, "Would you rather have a dead daughter or a live trans son?" And yeah, my friend was like, "Hey, I want to live. I don't want to kill myself." So from that moment on, she decided, "I am transitioning."
Uh-huh, uh-huh. Yeah, that's really, really awful. That's another huge area of lies that surrounds gender ideology because they push the myth that young people will suicide if they're not allowed to transition. But the opposite is true, that they are much more likely to commit suicide after. And there's not a lot of good studies on it, but the studies that do exist show that people who've had genital surgery have a 19 times higher risk of committing suicide than people who are matched for age and sex in the general population over a 30-year period. So the suicide rate before transition is equal to the general population, and after transition, it was 19 times higher. So, they've just got their risk round the wrong way, that transitioning and harming your body is the suicide risk, not being denied, the transition medicine in the first place. Now, I
Wow.
think that's it. I think we've got the rest. Yeah.
Right. Yeah, and I'm glad you clarified that it was at the baseline of the population at the beginning, because I had forgotten all about that.
Uh,
But yeah, like everyone is like 19 times higher after the surgeries are over, 19 times higher. But I forgot like the population starts out relative close to the baseline of the population when mental health and other factors are controlled for.
yes,
Yeah.
yes,
Then researchers seem to finally be studying what is the long-term outcomes with this population of children. Like, what are we able to see? And one of the things I've really noticed in the research with adults is they seem to want to stay within the golden window. And that's under 24 months post surgery is the highest satisfaction rate. So the longitudinal research that is done on adults is all under 24 months and under.
yeah, yeah,
As regret really peaked at 7 years. It
yes.
started going up around 5 years, peaked at seven, and then maintained at a plateau level, ever increasing until death.
Mhm.
Um, yeah.
Yeah, the research that's published by, the trans lobby is so flawed and so dishonest that you cannot have any faith in almost any of their research. It's very flawed. And if it were being offered in another field of medicine, it would never get through peer review. But now there are so many journals devoted just to transgender health And all the studies get through, and guess what? They all say it's marvelous, you know.
Yeah, I was looking at that. You had reviewed several of the systematic reviews of the research, and just the percentage of peer-reviewed research in this area that gets refused for a review because it's methodologically flawed was quite concerning.
Yeah, yeah, yeah. Um, and it is really intellectually dishonest to publish horrifically flawed research, um, and use it, you know, for policy, use it to, argue that we need more services, need more gender clinics, we need more people trained in transitioning,
Yeah.
children and adolescents. And it's all flawed research, no systematic reviews, no randomized controlled trials, no long-term follow-up. Often and mostly no control groups in the studies published by the transgender lobby. It really is, if those people handed in those papers, for a university class in research methods, they would all fail. They're so bad. And yet they're published, they're disseminated, you know, they're used as evidence for creating government policy and clinical guidelines, Just as an example, in Australia, there's a big hospital in one of the states, Victoria, and in the capital is Melbourne, and there's a big Royal Children's Hospital there that has been a flagship for transitioning children. And the then director of the gender clinic, a person called Michelle Telfer, um, developed these so-called clinical guidelines for Australian treatment of transgender children. And just to give you an idea of how bad it was, it did not even get to the review stage for the National Health and Medical Research Council. And when Hilary Cass from the UK did her review, she had experts rate the clinical guidelines from the different countries. And just for a comparison, Sweden's clinical guidelines rated 70%, and the Royal Children's Hospital guidelines rated 19%. And yet, they are the guidelines that have been used to inform gender medicine for the young people in Australia. It's
Now,
truly,
are these the same guidelines that are claiming that social transition is harmless and should be encouraged?
yes, yes. Yeah, I mean, I think WPATH and USPATH also endorse the fact that social transition is a neutral, it's fine, don't worry, but it isn't fine. And we know it isn't because we look at these young people from the Pacific Islands and from Asian countries, who for socio-cultural reasons have been forced to live as the opposite sex. And they are very disturbed people as adults, very disturbed. And I've worked therapeutically with a couple of these people, and they've got very significant psychological and psychosexual problems that they've never been able to resolve.
So,
Even though some of them are middle-aged now.
so it's very consistent with what happened with Money and the Reimer twins here in Canada,
Oh, yeah.
where boys ended up very deeply broken by.
That was just such a terrible tragedy that he was allowed to, practice at all. But for those twins, I think they both ended up committing suicide. It was the worst of malpractice, it was appalling. But
Well, the travesty of justice in not publicly sanctioning him. I was listening to I'm trying to remember the researcher, but so in the end, all they did with money was they put him in like he was no longer able to publish anything that wasn't approved by somebody else. He wasn't able to do research that wasn't approved by somebody else, but they didn't publicly expose his fraud.
Mm,
They publicly expose the extent of his lack of professional ethics. Like
mm,
none of that at that time was publicly exposed. So the lie was able to push forward for what it did influence the field for another 20 years before it really got to be talked about at a public level of saying this was wrong.
absolutely. Yeah. 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 It was a terrible tragedy. And, it was an exploitation of naive parents who, were following so-called expert medical advice. And those children, especially the one that was raised as female after the botched circumcision, he
Mhm.
had a very desperately unhappy life. Um, and yes, some people are not sanctioned for the worst of ethical violations. And yet, in this country, in Australia, we're just daily hearing about our colleagues being stood down and refused permission to practice because they've made a statement that men can't be women and women can't be men. We've got a case being prosecuted here right now where a breastfeeding counsellor said that men cannot breastfeed. So she's being sued in one of the big courts here for vilification. It's really a bizarre, more bizarre than Alice in Wonderland, what's happening in this country. Yeah.
Breastfeeding women are advised if you're taking medication A, B, C, D, don't breastfeed during this period of time because it will be in the breast milk.
Yeah. Yeah.
And yet, the hormonal and chemical cocktail that they give to men, as far as I've been able to find out, there is no research on the effect of what is the secretions that are produced on the infant that consumes them.
Well, I was speaking to a neonatal pediatrician about this issue, and he said, even with all the stimulants, that might be pumped into a male body to develop the breasts and whatever, the secretions are so minimal that it wouldn't represent 1/10 of the baby's needs for nutrients. And so they would have to supplement, with other women's breast milk or formula that a man even a trans man cannot breastfeed. They might produce a tiny bit of fluid out of a nipple, but it isn't enough to feed a baby. And so the statement is correct, even in our, bizarre world of creating false breasts on men. But yeah, the court case is still going ahead.
Yeah, that's the other one I'm aware of, but I don't know which country it is with a man wanting to attend a late term miscarriage support group for women and complaining that it's transphobic that he's not allowed to participate in the group. So it's for women who lost babies during childbirth or in the last trimester to support them through the grieving process. And
Right.
he wants to participate because he's had a simulated um, miscarriage.
What do you mean by simulated?
Well, he's male, so obviously he couldn't be pregnant. But he went through a process of um, getting padding for his stomach and pretending that he was pregnant, and then yeah. So
Wow.
where in all of this is the therapeutic value of no? Because it sounds like for some people there's never satisfaction, and you went into this a little bit with males who transition, who they have the first they develop breasts in response to the estrogen, and then they get castrated or have their penis amputated at the same time. And then even after those surgeries, however they turn out, then they start looking at other parts of their body, going, this isn't feminine enough, and this isn't feminine enough, and this isn't feminine. And where as a medical profession do we need to say no?
Yeah.
Um, because with John Hopkins University, that was one of the things that really sticks with me in reading what I've been able to find about that is that the cohort that got approved for transitioning and the cohort that got refused, because back then they refused about 80%, right? But at the 10-year follow-up, when he was just looking over the um, case files, thinking that they could put together a case review and show how wonderful this sex reassignment was. What he found out was those who got the surgery 10 years down the road, their global level of functioning had significantly dropped. Where those who were told, no, you'll never get the surgery, you'll never qualify for the hormones, but we're going to give you the psychiatric, psychological support, counseling, their global level of functioning improved.
Right.
And that's why the John Hopkins surgical sex reassignment surgical clinic was shut down in 1979. And yet today it sounds like we're just giving more and more and more surgeries or options or choices. And I don't see anywhere where people are happier on a global level as a result of accessing these.
Yeah. Yeah. And the really shameful thing about what's happening today is that no country that I can find has a central registry that records the number of people plus some of their demographics, age, sex, ethnicity, etc. There's no central record of who is receiving these surgeries. So the only information that I could access was through the insurance companies. And there's a very big insurance company in America who does keep very detailed records for obvious reasons. And their figures are quite chilling about the number, but it's a gross underrepresentation of the total number of people in America who've had, as they call it, gender affirming surgery, whether it be, double mastectomy or vaginoplasty or orchiectomy or whatever. So the only records of people who have got a compensable insurance scheme, but lots of people don't, and lots of people are accessing other means of having it done. So in every other disease that you can think of, heart disease, all the different forms of cancer, diabetes, and all of these things, there are central registers. And, epidemiologists need those registers to look for population patterns and identify risk groups and all of these kinds of things. But we don't have it in gender medicine. They are just above, the baseline requirements for every other field of medicine. So we really are not able to make population-based statements about a whole range of interventions that are happening in the gender medicine arena.
I just have to sit with that for a sec. Um, because we know from what is known, and we talk about this in the gender critical movement, is transitioning the child was created because the outcomes with adults were so poor. But the research that's being done on youth, the outcomes aren't any better, but we keep pushing it forward. One of the things I was hoping to ask regarding that is there any formal differential diagnosis between early desistance and internalized transphobia? Like I know with the adults, when I talked about not knowing if transitioning was helping me, my peer group said that's just internalized transphobia. You just need to go through the next part of the process. After you have this surgery, after you get your ID changed, after whatever, it's the after, then you'll feel better. Then you'll feel like a man. Then you'll feel blah, blah, blah. Um, so how do we identify that in youth? Like what in all of this, all of these guidelines that are being put forward, and pushed forward by the trans lobby, is there any acknowledgement of desistance? Because we know in youth that the desistance rate, you're going to, depending upon the measure, it's anywhere from 50 to 90%. So we should be expecting this huge desistance rate in this population before they hit the age of 20.
Mm.
So how do they put forward in their guidelines for teachers and school counselors and principals and family doctors to recognize and support desistance?
Um, Generally speaking, desistance is denied in the WPATH circles. And even I think it was Marcy Bowers from memory who said that desistance wasn't a concept that sat comfortably with WPATH members and that it was a bit of a taboo subject. And I actually read a study for the book which claimed that there was zero desistance in their population of young people. But if you go and talk to the detransitioners, a lot of them will say that they had internalized homophobia or internalized transphobia as part of their psychological complex. A lot of them, had experienced really significant trauma as young people. A lot of them had been bullied, marginalized, um, ostracized. Some of them had been assaulted. And often there is significant family pathology in these families. Um, in some of them, there's like a really significant toxic masculinity model in the family. I've come across a whole range of underlying reasons that need to be worked with therapeutically, but the young people don't give themselves the chance to do that because they've been, persuaded by the influences on TikTok and the medical profession, the GPs, the pediatricians, the endocrinologists, the gender clinics. There's a conspiracy of affirmation in this country. And we cannot, you know, for those of us who are practicing non-affirming psychology or psychiatry, we have to do it underground. We have to do it by stealth, because everybody who puts their head above the parapet suffers significant loss or disadvantage in terms of their registration and their a right to earn a living practicing their profession in a responsible way.
When I took my mental health care, supporting the mental health care of the transgender population back in the mid-aughts, is a list of reasons why children would not have been approved. for transitioning
Yes,
in
yes.
2006, 2007, 2008. And we've gotten to a position now where all of what used to be called the red flags
Mm,
are now just being ignored.
yeah,
Okay.
yeah, absolutely, absolutely. I've done some legal cases where the parents are separated and one of the parents doesn't want their child to transition, the other one does. And
Mhm.
except for one of the most recent cases, which was called Ray Devon, it was a pseudonym because all family court matters are sealed because they're minors. Um, and except for that case, the behaviour of the family court has been shameful, absolutely shameful. And we've been left with cases where both parents have partial custody, the custody is shared between the two parents. And for a child that I'm thinking of, he's a biological male child, and his mother treats him as a female when he's having access time with her. And when he goes to his father, he's male and he does male things and dresses in male clothes. That child is going to be very psychologically disturbed as he moves through, adolescence and into early adulthood. Um, Terrible situation. And how anybody could think that was appropriate is beyond me. I mean, even Solomon wouldn't cut the baby in half, to keep the parents happy. And that's what's happening to our children. But generally speaking, the family court has been approving of 15-year-olds starting cross-sex hormones. We're battling it on all fronts, the medical front, the legal front. The education department policies are an absolute disgrace. They just fly in the face of established science and biology and genetics and so on. And teaching children that women can have penises and men can have vulvas. And, these are the books that children are being shown in, kindergarten and grade one. Yeah, I mean, I do a lot of head shaking these days because I'm just running out of words to describe my utter dismay at the stupidity and the immorality of the gender affirming movement.
It seems like there is no lie that is too big for a gender activist to make. Like, I'm thinking about the research where it was showing that at the 2 year follow up, there had been a decrease in suicidal ideation. And then the statisticians got a hold of it and were like, whoa, what happened to completed suicides here? That issue was addressed and completed suicides were added into the statistical analysis of suicidal ideation. It showed an increase in suicidal ideation and completed suicides. But they'd shown a decrease in suicidal ideation on their original peer-reviewed research because they excluded people who completed suicide because, of course, if you're dead, you can't be thinking about killing yourself.
That's black humor, isn't it? Yeah. Yeah.
Yeah.
Yes, the whole trope around suicide is one of the most shameful tactics that the trans lobby has used to persuade parents to place their children on the trans train, um, and to, have the parents think that they're being good parents by allowing it to happen.
Did you find any evidence that there is an increase in suicide in young people whose parents do not permit them to medically transition?
We don't have any systematic data collection on questions of that kind. And in Australia, there is a ban on media reporting of youth suicide because of the
Mhm.
social contagion effect. So
Yeah.
we have no way of knowing the answer to that question. And even if a young person did commit suicide, that would not be the only ostensible reason that they would do that. There would be
Hmm.
a huge amount of other pathology going on simultaneously.
The very famous case that I'm aware of that happened recently here in BC, the young man in question at Tumbler Ridge was deeply unhappy um, with the masculinization of his body while trying to present himself as a woman. And there'd been a tremendous amount of involvement with police, tremendous amount of involvement with social services, tremendous amount of prescription of mental health medications. Um, and he committed suicide after several years of transitioning.
Right, right. Yeah. That does seem to be the more typical pattern from the data that we have. But because there are no central registries of data, we are relying on anecdotes. So yeah, it's a very difficult situation we're in because people are making um, statements in very firm voices and with great assurance that certain things are the case. But when you try to delve into the literature and to find the robust record keeping that is needed to make such statements, it is absent. So
Yeah.
there are lots of things that we don't know about what is happening in transgender medicine.
It's one of the things that, like, with the trans activists' response to what's happening in England, where they rallied the troops and were like, you have to put for the adults who are transitioned as kids, they were saying you have to put in a um, it's the opposite of a consent to share medical information. You have to put this on your file so that the database will not report in the review that's coming up your medical data linking you to having been at this Tavistock clinic. So if what they're proposing is so good for youth, why are they attempting to block the very investigation that would show that?
Yeah, very good question. Absolutely. They are so slick. They have infiltrated every bureaucracy, every social institution, all the significant politicians, who could possibly, have an effect on legislation. They've infiltrated them all, and the rest of us were asleep for the first 10 years, not realizing the inroads that these people had made in transgendering, a generation of young people. Um, and that, it's a two-pronged attack. Firstly, it's the propaganda and the infiltration. And secondly, it's the absolute marginalization and vilification and even prosecution of gender critical voices. Um, and the two-pronged attack is very successful, and I hate to draw, parallels with, authoritarian regimes. But this is what's been happening, in Germany, prior to the Second World War. It's happening in Iran, in Pakistan, in China, Russia, it's a tried and true autocracy that has been established that has those two prongs, complete propaganda and changing of policy and the expulsion of dissidents. and
You-
none of the politicians can see it. They just, I don't know, they're too busy, wanting to be on side, wanting to be, demonstrating equality for all of the diverse, aspects of humanity. It's a terrible form of moral narcissism. They want to appear good rather than do good. Look at me, I'm so accepting, I do not discriminate between anyone. And look at us, we're the vilifiers and we're the people practicing conversion therapy and we should be in jail and stopped from practicing.
I liked how you talked about, like, talking about conversion therapy, where there is the inversion of the language.
Yeah.
So where there is, you're actually taking a boy, you're making these physical changes to his body, and you're then telling him socially you are now a girl. That is an actual conversion process. Whereas the therapy where you're taking a boy and you're saying, you know what, you've got, I hear your pain, I hear your emotional suffering. There's nothing wrong with your body, there's nothing wrong with your brain, and we're going to support you through this process. That is the conversion therapy.
Mm, mm.
But
Yeah.
physically changing children's bodies, and making them into lifelong medical recipients is not conversion therapy. And taking people who quite likely would grow up to experience same-sex attraction, and that is where the distress comes from in their pubescent period when they're first starting into puberty, um, and making them so it looks socially like they're in a heterosexual relationship. That isn't conversion therapy.
No, no.
So these two things where you're actually making this change are seen as the warm, loving thing to do, but the therapy that's saying, you're fine, we're going to help you through this emotional distress, is seen as the conversion therapy.
Yes, 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 it's definitely a sleight of hand, you know. The vocabulary is breathtaking, the way that
Mm,
language has been corrupted, to support this ideology.
well, I greatly appreciate your that we finally got to meet, that we got to have a conversation, and I've really enjoyed talking to you very
Thank
much.
you. Thank you. I've
Yeah.
enjoyed talking with you, and getting your insights on the process, because it's such an unsafe thing to do a lot of the time is, just to openly kind of interrogate what's happening in our society with respect to the transgender myth. And I've appreciated, sharing my ideas with you.
Yeah. I don't know if you've heard about the case, the human rights case here in British Columbia. The Human Rights Tribunal ruled that Barry Neufeld, who was a school trustee, who said that teaching Soji to kids is a really bad idea because we shouldn't be teaching boys and girls that there's multiple genders because there's really only boy and girl, and we should let them grow up and get to be of an age where they can critically evaluate the information that's being given to them. So, in the whole context of informed consent, when we know that the research is so compromised, how can children consent when the information that the adults are giving them is flawed, and yet adults can't critically look at the information and see where the flaws are? Like, if adults can't see through the deceptions, how are children going to be able to?
Yeah, absolutely. Yeah, yeah.